Don't burn up more fat and everything, right? So you're going to have weight loss, and it can go to cachexia, even though they're eating like a horse. They can get cachexia. Wish we could do that sometimes, right? Eat everything we want, not worry about it. Unfortunately, that doesn't happen. I wouldn't recommend hyperthyroidism as pure, though. Okay? And restlessness or hyperactivity. Again, that's a little difficult sometimes to assess in cats. My daughter bought us this little 8-week-old kitten that her neighbor found on her porch. Had been beat up and had respiratory problems, so my daughter took it down to be treated in Atlanta, but she figured it'd be cheaper to bring it to us. So she's fine now, but she's just, we have to keep her. She goes out and beats up on my big cat, so we have to separate her. But you walk in, she zooms all over. I just wish I had that energy. Basis. All right. Additional signs include abnormalities in hair coat. You get unkempt hair coat again. PUPD, vomiting, diarrhea, aggressive behavior, ventral flexion of the neck. See with that. May have lethargy, weakness, anorexia, and weight loss. And cats, again, they keep eating, so basically what happens to the satiety center if you keep eating too much? You get anorexic when you do that. Okay, see how unkempt his hair coat looks? And notice how he's sitting? That plantigrade stance back there. And does he look like he's nice and muscular, or does he look like he's kind of skinny? And he's got that look on his eyes. What is he saying? Oh, come near me at your own risk, right? Believe me, I've taken, when I was a student over here, I had to remove a hyperthyroid cat from a kennel, and I swore I'd never do that again without an armor suit on. But, they're wild, I tell you. Huh?
Did they give you anything to put on?
No, not that time. That's the first time I've ever been bitten by a cat. It was right there. Didn't feel very good. All right, this is a hyperthyroid 11-year-old domestic short-haired cat. You can see evidence of weight loss up there, anxious facial expression. And again, when a cat gets an anxious facial expression, what does that tell you better do? Back off or be careful, right? Again, you can see this hair coat. This is a long-haired cat. You can see some rough hair-coated alopecia in this animal. The hyperthyroid 13-year-old Russian blue cat down at the bottom that's been had excessive matting of the coat. She's just unkempt hair coat. And you can see it's a hyperthyroid 13-year-old cat up there in A. You see how emaciated it looks and everything. Same cat as an A 2 months after returning to a normal thyroid condition. Doesn't he look better? Mm-hmm. If you look down there at C, notice that it's ice cold in this clinic. What's the cat not doing? See, it's got that warm blanket in there, but it's ready to sit on that cold steel. Because what is their body rate? Heart rate, body temperature going to be way up and everything. And so basically, they, rather lay on a cool cage floor than on a pad. And if you look at that one in D, see how the animal's bending his head down like that? Of course, my neck to do that, but bending his head down. That's ventral flexion. And it's usually suggestive of a concomitant thiamine or potassium deficiency. It can also accompany thyroid problems, hyperthyroidism. Again, unkempt hair coat, plantigrade stance there. Ventral flexion of the neck, the animal couldn't even raise itself up. If a person dropped less than a hand, it would just collapse. The secondary complications of the disease, there's 2 of them that can be very significant, and this is hypertension and thyrotoxic cardiomyopathy. In other words, what effect does thyroid hormone have on the heart mainly? It increases the contractile fibers. You keep doing that, what's going to happen to the muscle? You get hypertrophy. So you get a hypertrophic cardiomyopathy. Is that going to cause a lot of circulatory problems and stuff? Now, as that continues, will the blood supply keep up? So you start losing the blood supply in these areas, what will happen to the muscle cells? They die. What do they get replaced with? Connective tissue. So you end up with dilatational cardiomyopathy. What would you rather have if you had a choice, hypertrophic or dilatational?
Hypertrophic.
Hypertrophic is reversible very often. Dilatational is not. Okay, that's usually the end thing. Okay? And you get basically, and you increase the heart pumping. What's that do to blood pressure? It increases. Can high blood pressure cause problems everywhere else? Yes. And so basically, in some cases, the hypertension can be so severe in the cat that you'll get retinal hemorrhages and things from it. So you get blindness as a result of it. And I think I've told you all before, sometimes you bring a hyperthyroid cat and put it on your aluminum exam table, and you'll hear that, because the heart beats so fast and so hard. And you can just feel it. You know, put your hand on it, you can feel it. Basically, these cardiovascular abnormalities detectable on physical examination, again, will be tachycardia, a pounding heartbeat. You can also get gallop rhythms, pulse deficits, all that stuff y'all had in cardiovascular physiology, right? Y'all remember all that, right? Well, anyway. Now, I did put that cardiovascular stuff on the blackboard. So if you want to go see what those things sound like, you can do that, okay? EKG abnormalities, of course, are going to be tachycardia, increased R wave amplitude, widened QRS complex. In other words, ventricular enlargement is what you're going to see as far as this is concerned. And on radiographs, you should see, like 1 or 2 intercostal space contact, or you're going to be more. On an X-ray, it's going to be much more. This is bigger, okay? Can you see pleural effusion and stuff? Because if the heart's not pumping properly, can that cause backup of fluid in the lungs and all that stuff? Yes. Here's just showing you the radiographs A and B up there of a hyperthyroid cat. Mild cardiomegaly was present. And if you see what happened to the heart when you get to C and D, this is 3 days later. What about the size of that heart? And what about the lungs? And some increased densities in the lungs and stuff. And then they treated it with furosemide. What's furosemide going to do? Pull the fluid off. And what's propanolol going to do? So it increases the heart contraction rate and all that kind of stuff. So it's getting a little better there, isn't it? So you send him home now, right? And he's going to come back and look like C and D in a few weeks if you do that, okay? You've got to treat this cat. Echocardiographic abnormalities, basically it would be left ventricular hypertrophy, thickening of the interventricular septum, left atrial ventricular dilatation, myocardial hypercontractility. In other words, hypertrophic cardiomyopathy, right? What you're going to see. Abnormalities when you have dilatational thyrotoxic cardiomyopathy is that it's kind of the opposite. You have subnormal myocardial contractility and marked ventricular dilatation. In other words, you've treated it, so it's come back to normal, but now you're starting to, your dose levels are too high, but it's not going to give you that hypertrophic again, it's going to just give you the dilatational part. So in other words, do you think thyrotoxicity can be more devastating than the initial problem? Yes, that's why we got to be monitoring these animals closely when we're doing this. After correction of your hyperthyroid state, your hypertrophic again, cardiomyopathy is usually reversible. That doesn't mean it will always, but if it's gone dilatative, forget it. That's not going to be reversible. Okay, as far as laboratory findings, they'll generally have an increase in T4. And if you got the increase in T4 and the clinical signs, that's your diagnosis. Okay? One problem is a certain percentage of cats can actually have a low normal T4 and be hyperthyroid because the thyroid hormone is doing this and you get it down here. Okay? So basically T3 is almost worthless as far as diagnosing thyroid conditions in almost any animal. T4 is much better. Okay? Additional laboratory findings, again, if you're getting involvement of your muscles and your liver and this type of thing, you're going to see liver and muscle enzymes. You're going to see hyperphosphatemia because basically increasing metabolism increases membrane transport, phosphorus comes out. So you get hyperphosphatemia. You can have a mild polycythemia. What's a polycythemia mean? It's an increase in red blood cell. So if you're increasing metabolism, can that cause an increase in red blood cell production? Hopefully not too much. Or you might have a mild non-regenerative anemia if you've worn out the bone marrow. Okay, and it can't respond. You can get azotemia, hyperglycemia, and hypocalcemia because with this you're going to increase blood flow through the kidney. That's going to increase fluid loss, and that can interfere with calcium reabsorption and also with basically the animal regulating, kidneys going to basically shut down if it keeps going. Okay. Plus, if you're increasing urination, can that give you dehydration? Can dehydration give you azotemia? Y'all remember what azotemia is, right? Increased BUN and creatinine, increased non-protein nitrogenous substances. Okay? Now, as far as your diagnosis, again, clinical signs, if you palpate a thyroid nodule and you got all these clinical signs, and you increase T4, that's your diagnosis. And again, usually as we say, most of the time, T4 is the most significant, and usually if it's elevated and you've got the clinical signs, that's your diagnosis. Now, if they aren't doing that, let's say T4 is just mildly elevated, what you can do is what we call the T3 suppression test. What's involved in negative feedback as far as thyroid hormone secretion? What hormone? T3. T3 is the hormone that goes back and shuts down your TSH and your thyroid. So if I give T3 to a normal cat, what should happen to my thyroid hormone levels? It should go down. What if they don't? Then that tells you it couldn't care less about that negative feedback, so that gives you the diagnosis. That's called the T3 suppression test, and we usually don't use it on anything usually other than cats, hyperthyroidism. And you may, if nothing seems to tell you what's going on, you can use radionucleotide, which is radioactive iodine. Uptake and imaging can be used, but most of us don't do that in our main clinics. Why don't we do this radioiodine in our normal clinics? What's one of the best ways to eliminate your thyroid gland? You get exposed to that stuff, and that stuff absorbs very readily through skin and stuff. Okay, so that's why we have these reference labs that we send the animals to, that type of thing. Okay? Treatment? What do you think? If you got a tumor doing it, what's the treatment? Remove it. And again, you can use oral antithyroidal medications, and you can use radioactive iodine, because radioactive iodine will eliminate usually the neoplastic cells, but in humans it will eliminate all of them. So you got to be careful with it. Okay? Again, if the thyroidectomy is not possible, you may just do a partial thyroidectomy. But when you do a complete thyroidectomy on both sides, what are you also probably going to have to be very careful you don't take out? Your parathyroids. You're not going to be able to leave the internal ones, but the external ones. Now, if by chance you can't do that, what are you going to have to treat that animal with for the rest of his life? Calcitonin. You're going to have to get calcium supplementation, possible calcitonin. Now, what if I have to go in there and I do have to take out all of it? Is there anything else I could do to reestablish my parathyroid? What you can do is sterilely mince that parathyroid up and inject it aseptically into the precothyroid area. Very often it will reanastomose with vessels, and you will basically give the animal back a parathyroid. And that works most of the time. But you've got to make sure you're doing it aseptically, okay, when you're doing that. Okay? Additional complications you see in cats with this is if you take them out, what can you end up with? Hypothyroidism again. Horner syndrome, laryngeal paralysis. Because if you got to be very careful when you take those things out, because there's a lot of things you make sure you don't want to cut when you're in here, right? Because if you cut the laryngeal nerves and things, you think that animal's going to be happy? Or you think an animal's probably going to die? Going to die. So you got to be very careful with that. And sometimes you can get persistence of your clinical signs even after you do treat them. Propylthiouracil and methimazole are the two main drugs they use for treating hyperthyroidism. They're antithyroid. What they do is they inhibit the synthesis of thyroid hormones by blocking incorporation of iodine. If you can't put iodine in it, what do you do to production of thyroid hormone? You inhibit it. Okay? Methimazole is the drug of choice in the cat because you can get immune-mediated anaphylactic reactions more often as far as your polyuracil is concerned, but sometimes you have to use that. And basically your goal is to obtain resolution of your clinical signs again using the lowest dosage possible of this antithyroid. You're going to have to probably treat this animal for the rest of its life with these antithyroidal drugs. Radioactive iodine, as we say, I-131, is one of the treatment of choice as far as radionucleotides for functional thyroid tumors. They say it only involves the neoplastic cells, but sometimes it forgets and goes and gets out the normal ones also. But More often it just gets the ones that are bad. And it's usually reserved for those animals that have bilateral markedly enlarged thyroid lobes that are basically not good surgical risk, or if you've already got metastatic, ectopic metastasis of the tumor, use them for that. Healthy thyroid tissue and parathyroid is not supposed to be affected by it, but I've seen some cases where that's not supposed to be, didn't hold, but about the majority of the cases it won't involve them. And once you use your radioactive iodine therapy, recurrence of the hyperthyroidism is rare. Okay. Prognosis? Well, it depends on what condition it's in when you diagnose it. Depends upon how much involvement you've got in the thyroids, whether or not you've got metastasis of the tumors, all this type of thing. But it's excellent if you take out the thyroid adenomas and you don't have problems with calcitonin and all that kind of stuff. So it's usually excellent as far as that's concerned. If it's a encapsulated carcinoma, that's usually a good prognosis, but if it's not encapsulated and it's invaded the lymphatics and stuff, prognosis is great. Okay?